Kenya has for long relied heavily on donor funding for the treatment and management of malaria, tuberculosis and HIV, with minimal contributions from the National Treasury. This funding enabled pregnant women to receive free treated mosquito nets and facilitated free treatment for HIV and TB at specialized clinics within public hospitals, among other free services under the three programs. However, this situation is set to change as the government steps in to take over these programs, incorporating them into the broader healthcare system. Patients will now be required to cover the cost of these services under the new Taifa Care initiative administered by the Social Health Authority. The Ministry of Health has stated that the shift is necessary to address the gap left by a recent freeze on foreign aid from the United States for 90 days and suspended USAID.
This is becoming a stark reality that we really need to move towards that, so that we don't have HIV, TB programs standing in silos, but we have them integrated. And this is again part of the initiative to have one plan, one M&E, one budget. And you see, by that we'll be able to secure so many resources that have been falling through the cracks over time immemorial because of fragmentation of various programs within the ministry.
However, some view this move as potentially overburdening the Social Health Authority, which has not yet raised sufficient funds, while country's health budget allocation remains insufficient.
Let us also be cognizant as Kenya that this is not just a Kenyan issue. It's not even an African issue. It's a global issue, and it's calling on us to strengthen our healthcare system in those levels.
This comes even as ACK Archbishop Jackson Ole Sapit supported the withdrawal of USAID funding on grounds that it's time African leaders were held accountable, claiming that the funds have over time been misused by leaders.
Trump disruption of the rest of the world must be a wake-up call for us to be able to think. Every other economy grew, not in easy times, but when they were faced by a crisis, they think deeper.
The Ministry of Health has also admitted to a shortage of cancer drugs, particularly Herceptin and letrozole, in public health facilities, attributing this to counties' failure to pay KEMSA, thus preventing access to the drugs from manufacturers.
We are in discussion with Social Health Authority so that when KEMSA supplies a medicine to a county, instead of us waiting for the county to pay KEMSA, when SHA is paying the counties, the portion for pharmaceuticals should go direct to KEMSA, so circumventing that process.
The government has since pledged to collaborate with both public and private facilities to expand the distribution networks for cancer drugs and provide financial subsidies for high-cost cancer treatments. Eunice Omolo, K24 TV, Nairobi.